aka valgus stress test, indicates MCL injury.
Yeah, first part of this is have the knee fully extended, do the stress, the valgus stress that way. There's no pain, you can bring it up to 30 degrees and then do it again. Positive for this would be medial collateral MCL.
Adduction stress test, aka varus stress, indicates LCL injury.
Again, first keep it extended, give it a varus, and then bring it to 30, do the same thing. That would be for LCL.
Apley's compression test indicates medial or lateral meniscal tear.
So basically what I'm going to do is push down, compress this, heel points to the side of the meniscus tear. So I go this way and there's pain, lateral meniscus, bring it this way and there's pain, medial meniscus because the heel's pointing that way.
Apley's distraction test indicates MCL or LCL tear.
Okay, same thing, except you're basically distracting it. So stabilizing here, lifting up here, heel points to the side again. So this way is LCL, that way is MCL.
Apprehension test for patella indicates chronic patellar dislocation.
You start with the patella, move it medially, then laterally. I'm looking at his face, see if there's any pain. Also, I'm looking at his quads to contract to help stabilize the patella.
Allotment test indicates chondromalacia patellar or fluid under patella.
Basically, just going to push down on the patella, watch it float.
Bounce home test indicates osteochondritis dissecans or meniscal tear.
Just bring it here, basically I'd let this go and it bounce home like that.
Anterior drawer, posterior drawer test indicates ACL or PCL tear.
Okay, so here, hip is at 45, knee is at 90. I'm going to stabilize here, pull this way for an ACL, push that way for a PCL.
Boucher's sign indicates patellar tracking disorder or patellofemoral dysfunction.
Boucher's, you just basically rub the patella back and forth, like it's pain.
Lockman's test indicates ACL instability or tear.
Lockman's test is the acute stage of an ACL or PCL. So basically instead of 45, you put it down to 30, you still stabilize, pull here for ACL, push there for a PCL.
McMurray's sign indicates lateral meniscus or medial meniscus.
Okay, so what I'm going to do here is you first internally rotate the leg. As I internally rotate the leg, if I do a valgus type of stress, I am testing the lateral meniscus. And then opposite, if I externally rotate the leg, I was on this side, externally rotate the leg, give a varus, that would be for a medial meniscus.
Noble compression test indicates IT band syndrome.
Basically just get it on this side, with that IT band, and just kind of pumping it like that. Looking for pain.
Patellar grinding test, aka Clark's sign, indicates chondromalacia patella.
So when you basically push the patella down like that, and then look for them to have any pain or any contraction there because they don't want you to do it.
Pivot shifts test indicates ACL laxity. Hip flex to 90.
Okay.
Knee extended.
Okay.
Doctor internally rotates the tibia by turning the foot medial.
Knee extended.
Okay.
Knee is then flexed approximately 30 degrees.
Okay.
Use a valgus force.
Use a valgus force.
You're looking for shifting or clunking of the tibia posteriorly.
Okay.
Indicates ACL laxity.